The first part of this module covers infectious diseases and risks. In this part, we will cover diarrhea diseases, neglected tropical diseases as wash-related infectious diseases, and we will also dive deeper into AMR risks at healthcare facilities as it significantly impacts the health, well-being, and safety of persons seeking health services, their carers, and healthcare workers on the front line of health systems. Despite advances in technology and medicine, diarrhea diseases continue to be a significant health threat globally, worsened by pressures such as population growth and urbanization that outstrip infrastructural development. Based on global health data from 2019, the World Health Organization, also known as the WHO, and UN Children's Fund, also known as UNICEF, estimate that approximately 1.4 million deaths can be attributed to poor wash. 69% of these deaths are due to diarrhea. This means that diarrhea accounts for most wash-related health burdens, not just in mortalities, but also in disability-adjusted life years. The F diagram, also known as the fecal-oral transmission pathway, is a conceptual framework used in public health to illustrate the various routes through which fecal matter containing pathogens can contaminate the environment and subsequently cause diseases when ingested by humans. The F diagram typically consists of 5 main components, each representing a different stage in the transmission pathway. Feces. This represents the initial source of pathogens, typically originating from human or animal waste. Feces contains a variety of disease-causing microorganisms such as bacteria, viruses, and parasites. Fluids refers to any liquid substances that may carry fecal contamination, such as drinking water, wastewater, sewage, or runoff from agricultural fields. These fluids can serve as vectors for transporting pathogens from fecal sources to water bodies or food sources. Fields represent the natural environment where fecal matter can come into contact with water sources, soil, or crops. Improper disposal of human and animal waste and inadequate sanitation practices can lead to fecal contamination of agricultural fields, irrigation water, and surface water bodies. Refers to insects, particularly houseflies, which can act as mechanical vectors for transmitting pathogens from fecal matter to food and water sources. Flies can land on fecally contaminated surfaces and transfer pathogens to human food or water during feeding or resting. Fingers represents the direct contact between contaminated hands or fingers and the mouth, which can occur through poor hygiene practices such as inadequate hand washing after using the toilet or before handling food. This pathway transfers fecal pathogens directly into the gastrointestinal tract, leading to infection and disease. The F diagram therefore highlights the multiple pathways through which fecal oral diseases can spread within communities, emphasizing the importance of implementing comprehensive wash interventions to prevent contamination at each stage of the transmission pathway. Neglected tropical diseases, NTDs, are a range of 20 infectious tropical diseases caused by viruses, bacteria, or parasites with a singular commonality. Their impact on 1 billion people at risk of debilitating health, social, and economic consequences in impoverished communities. Here we see protozoal, viruses, bacteria, and helminth. These diseases are largely treatable and preventable through improved wash, control of vectors like insects transmitting the diseases, and effective drug treatments. But they are neglected because they are overlooked in health agenda. Thus, there are limited resources to prevent their spread. Factors such as climate change are broadening the geography of neglected tropical diseases. Microbials are a range of medicines, including antibiotics, used to prevent and treat infectious diseases in humans, animals, and plants. Antimicrobial resistance occurs when targeted pathogens no longer respond to medicine. The increased antimicrobial use is worsening antimicrobial resistance. Growing AMR is a significant threat to global health and development. Unfortunately, increased antimicrobial use due to misuse or because a medication is not as effective is worsening antimicrobial resistance proliferation. Increased AMR also translates to increased risk of disease spread, severe illness, and death. The World Health Organization estimated that 1.27 million people across the world died in 2019 due to AMR, with AMR contributing to a further 4.95 million mortalities. Also, the World Bank has estimated that AMR can result in 1.34 trillion US dollars in gross domestic product losses per annum by 2030 and an additional 1 trillion US dollars in healthcare costs by 2050. Of particular concern is AMI risk associated with poor water, sanitation, and hygiene or WASH in healthcare facilities, given its impact on infection, prevention, and control measures. Data from 73 countries for a 2021 WHO and UNICEF report alerted us to 1 in 5 healthcare facilities lack basic water services. 1 in 10 healthcare facilities have no sanitation services, and half of healthcare facilities do not have basic hygiene services. Why is this significant? 1.7 billion people are without basic water, 780 million with no improved toilets, 3.85 billion lack basic hygiene. WASH in healthcare facilities is therefore a critical safety concern. Poor WASH can affect the well-being and decisions of individuals and their carers seeking healthcare services, as well as the morale of staff at the front line of healthcare. Infection, prevention, and control measures, IPC measures, include WASH. They are critical to help reduce the number of hygiene-related infections in healthcare facilities and reduce unnecessary antibiotic use, thereby helping to curb nascent AMR.